Good evening. ازيكم؟ كلكم كويسين؟ الحمد لله. Okay, I'm leaving you the chat. Okay, chat box. If you want to ask a question or write anything, please type في chat box. I'm going to see it طبعا. Today, I'm going to explain atherosclerosis. Now, let me explain what's the meaning of atherosclerosis at the beginning. The word atherosclerosis, let me change this color because it's very dark. The word atherosclerosis, athero means something dealing with the blood vessels, and of course here I mean the arteries. And sclerosis means hardening. So this kind of disease or abnormality, it is called the hardening of arteries. Let me at the beginning revise with you the artery or transverse section in an artery. I said before that the artery or the arterial wall is formed of 3 layers. The outer layer is called tunica externa, and it is in the form of connective tissue together with a little amount of elastic fibers. In the middle, there is the thickest layer, and this layer is called tunica media, and it is formed, who remembers what is it formed of? You can type on the chat box. The tunica media. Yes, excellent. Excellent, bravo. Yes, it is formed of smooth muscles together with elastic fibers with collagen fibers. Yes. Type. An inner layer, it is formed of, yes, thank you. Thank you. Now, what's the name of this layer? What's the name of this layer, ya Sahar? Yes, this layer. Huh? You remember the name? Tunica what? Of course, yes, yeah, thank you. Tunica media. Sorry, tunica interna. And this is formed of, as Sahar said, epithelial cells, or epithelium. طبعا, when we say epithelium, this is something that is covering from outside. That's why هقول عليها endothelium, because it's a layer of cells that is covering from inside. And I said before that the word tunica interna, it has another name, intima. It means that it's an intimate relationship with the blood that is found inside here. This is to refresh your memory about the wall of the artery from inside. And the lumen of the artery, of course, is circular or nearly circular, and it is narrower than that of the vein. Right. Let's return back to our atherosclerosis. The main damage that leads to this kind of artery hardening is a damage in this layer, in the endothelium of the tunica interna or tunica intima. Type. What is the cause of this damage? We have here 2 causes. Either by high blood pressure Who can tell me the medical name of high blood pressure? Yes, Luay? Okay, hypertension, thank you. Excellent. And the other cause, let me mention this cause. For example, the chemicals coming from the cigarettes or the tobacco smoke, like nicotine. Both of them, they cause damage to this endothelial lining of the arteries. But what happens? We all know that in the arteries, there is normally the blood has a pressure because the blood is pumped by the force of the ventricle of the heart. Which ventricle? Remind me quickly. Left, yes, thank you. So the blood in the arteries, the blood is moving under pressure, and it is moving, of course, very fast. If there is any, when I was explaining the blood clotting, I told you that one of the factors that prevent the clotting of blood inside the arteries is that the wall of the endothelium is intact, and it is flow of the blood is smoothly flowing because there is no friction with any surface. That's why the blood is moving smoothly, it's moving fast under a certain pressure, so everything is normal because the endothelial lining is smooth. What if this endothelial lining had a certain damage? So here, because of this damaged area, the blood is going to make somewhat like friction here, so it's going to slow down. And this is the beginning of formation of atherosclerosis, slowing down of the blood at this damaged area. Now, the blood, as we all know, is carrying several materials, and one of these materials is cholesterol. And we have known this kind of material before, and I said that it's a kind of derived lipids or a kind of lipids, and it is found normally moving with the blood, but in moderate amounts or in certain amounts. If the amount of cholesterol increased in blood, so when the blood slows down, this cholesterol is going to accumulate or to build up like this. Building up of cholesterol on the damaged part of the endothelium is called the plaque. And it has another name, the atheroma. So this is the beginning of formation of atherosclerosis. Now, let's look at this picture. Let me get this toolbar. It covers a part of the board. Now, this is the artery. Of course, this is a longitudinal section. If I took the artery and divide it in lengthwise, I'm going to get a longitudinal section like this. Yani, if this is the artery, for example, and I'm cutting it lengthwise. So it's going to give me this, which is the longitudinal section. Of course, this is the wall of the artery, this is the other wall, and here is the blood moving. So if you can see here that this is the endothelial lining, or which is the smooth endothelium, and there is a certain damage here. Look at this yellow part. So this is a slight damage that happens in the endothelial lining of the wall of the artery, and it will start the formation of the plaque. Right. The problem is that if this kind of this atherosclerosis happened in the coronary arteries that supply the heart, or the carotid arteries that carry the blood to the brain, so this will give a great damage to the body. which I'm going to explain, of course, now, inshallah. Here, I just said that this damage is due to two reasons. Either due to hypertension or high blood pressure, or due to the effect of chemicals like nicotine, that is a chemical, of course, found in the tobacco smoke. So here we are going to see that the blood, of course, that is moving in the artery, and it met a damage. So at the beginning, there will be a sort of inflammatory responses. Let me write it here. But what's the meaning of this word and why does it happen? Because this is something abnormal that happens in the body. Whenever there is something abnormal, so these inflammatory responses happen. الانفلامatory اسمها زي الالتهاب, coming from inflammation, of course. فالinflammatory responses, when they happen, بلاقي ان الوايت blood cells, they come quickly towards the area of damage, because the white blood cells, of course, they are concerned with immunity. So this is something strange that's found inside the body. So the white blood cells, they come quickly in order to overcome this strange thing that happens in the body. With the arrival of a great number of white blood cells at the site of damage, also we find that there are not only white blood cells, there is deposition of chemicals that are found in the blood because of this damaged area. When I said that there is a sort of friction between the blood components and this damaged part, and of course the blood is going to slow down. Chemicals that accumulate or build up at the site of damage, these chemicals, of course, include what's most important chemical is cholesterol. So cholesterol starts to build up like this. Look at this damaged area, and this is cholesterol. Of course, cholesterol is a kind of fatty deposit. It is yellowish in color, so it's going to deposit. At the beginning, of course, I'm going to draw this here. If this is the area of damage, so here is the cholesterol depositing like this. So the deposition of cholesterol is going to narrow the lumen of the artery. Look here, there is no deposition, but look here, the lumen became narrower. Now again, because the blood is still flowing and it comes here at the area, let me erase this. خلاص عرفنا what's the plaque or deposition of cholesterol. So when the blood is moving and there is a deposition of cholesterol, the blood accumulates just before this plaque. The name is not written. Let me write it, plaque. So when the blood becomes slower and it meets this plaque, there will be deposition of starting a clot formation or a clotting cascade that will end in the formation of fibrous tissue or fibrin together with calcium salts. Of course, this is these materials, they are going to form a clot on the wall of the artery, or damaged part of the wall of the artery. Here, fibrous tissue and calcium, they build, calcium salts طبعا, I wrote ions, they build up around the clot, and they cause more narrowing to the artery. يعني narrowing here might be very narrow lumen, or because of more and more deposition, the artery can be blocked completely. طبعا when the artery is narrowed, so this will increase more and more the blood pressure, which will add more and more damage, not here, in other areas, in other arteries, in other areas of the body. طبعا when the blood pressure is high or it becomes higher, this is going to put a load on the heart, it's harder for the heart to pump the blood. And as I just said, there will be deposition of plaques in any other part, any other artery of the body. If you looked here at this corner, we have here some learning tips and some exam hints. We have to take care of these. Here, the learning tip, remember that the damage to the endothelium occurs first and then often caused by, and this often caused by the blood pressure or as a result of smoking. Of course, here we need nicotine. What about the exam hint? It says that learn the stages of development of atherosclerosis. At the beginning, damage of the endothelium of the artery, then this is followed by inflammatory responses, then accumulation of cholesterol, which forms the atheroma, and I told you it's called plaque as well. Then afterwards, the fibrous tissue and the calcium salts, they start to build up on the plaque, leading to more and more narrowing and loss, of course, of elasticity of the artery. But why there is loss of elasticity or hardening? Look at these materials that are formed. Which of them will lead to hardening of the wall of the artery? Yani, I want you to think a bit. Which one of them will cause hardening to the wall of the artery? Nobody's answering. Let me choose. Mariam, can you tell me which material of these, cholesterol or fibrous tissue or calcium salts, which one of them is going to make a hard wall of the artery? No, fibrous tissue, no. Let me remind you of something. Bones, why are they hard? Yes, it's calcium. Yes, thank you. Thank you. It's calcium, of course, because of the deposition of calcium. So this will lead to hardening. And at the beginning, I said that atherosclerosis means hardening of the wall of the artery. And of course, hardening here or atherosclerosis, it happens in arteries because, and not in veins, because the arteries, inside the artery, the blood is moving with a pressure and also because the lumen is narrower. So whenever there is any effect, the effect will be on the endothelial lining. In the veins, there is no pressure. Yani, when I was explaining the veins, I told you that the pressure inside the veins is how much? Who can tell me this information? I forgot it. Can you remind me, please? No? Try another one. Yes. Yes, Kenzie, it is 10 millimeters mercury. Yes, thank you. But in the arteries, it is 120 over 80 millimeters mercury. So this is very high if compared to that inside the vein, of course. These are the reasons why there is deposition of plaques or atherosclerosis in arteries and not in the veins. But what's the effect of atherosclerosis on health? Of course, when I say on health, it means that atherosclerosis can affect any part of the body. But let me begin with this effect. aneurysm. What is this aneurysm? Now, I just told you that if this is the wall of the artery, and this is the, of course, tunica media, and here is the tunica intima or interna, and here is the plaque or deposition of the plaque or atheroma, or together with the clot. Blood is going to accumulate here. Of course, the other blood is moving if the artery is just narrowed. But just before this mass, there is deposition of blood here. Because blood is found here, it's going to put a load on the wall of the artery such that in a time the artery is going to look like this. And here is the plaque. So there is going to be like something pressing on the arterial wall until the arterial wall becomes weakened. This weakened area is called the aneurysm. The danger here is that this aneurysm might split open. So, of course, if it's split open, the blood, let me erase this, all the line is going to be erased. This is the disadvantage of Zoom. Like this. It might split open, so blood is going, of course, to pass outside the artery, leading to a very dangerous condition. Yes, thank you. Internal bleeding. This internal bleeding is fatal. Where usually aorta or the arteries supplying the brain or the aorta, when they have this aneurysm, and this is very, very dangerous, of course. Where the main part of the aorta that suffers this aneurysm is the part where the aorta is moving through the abdomen. We know that the aorta gets out of the aortic arch, or it gets out of the left ventricle. It takes an arch like this, and then it moves behind the heart, the back of the abdomen, or the back of the body, and it supplies every part of the body, of course. And at the part where the aorta is moving in the abdomen or in the abdominal area, this is the most part of the aorta that is affected by aneurysm. Of course, the aneurysms, they are usually fatal unless they are diagnosed early and treated with surgery, of course, before they burst or before they snap open. This is the first effect of atherosclerosis on health, which is aneurysm. But let me go now to the second effect. And I already mentioned it. And whenever there is atherosclerosis, so there is more and more hypertension or raised blood pressure. Hypertension means raised blood pressure. Now here, because the arteries are narrowed, so the arteries, of course, when they are narrowed, they lead, or they add to the high blood pressure, and this may lead to, again, damage of some organs. The most important organs that are damaged are the kidneys, and I'm going to explain now why. والbrain طبعا, and the eyes. Now, what happens in the kidneys? We know that the kidneys filter the blood from wastes, and we have taken in our OL that the kidney is formed, our kidney tubules is formed of the Bowman's capsule. I'm not going to draw them all طبعا. And here we have the afferent arteriole, and here is the glomerulus, and here is the efferent arteriole. So remember when I said that the blood pressure in the arterioles, يعني in the great arteries, yes, it is 120/80. In the arterioles, it reaches 85. I'm going to make a comparison between the 120 in the arteries, the big arteries, and in the arterioles. Of course, this is normal. At the entry of blood to the capillaries, the blood pressure becomes 35. And this is very important, of course, millimeters mercury. This is very important to protect the capillaries from bursting. What if there is hypertension or the blood pressure is high? So the capillaries that are found in the kidneys, they are going to burst. Because of course, the blood pressure, when the blood reaches the capillaries, blood pressure is higher because we have here hypertension. So the capillaries are going to burst. And of course, even if the capillaries did not burst, this high blood pressure بتعمل damage للtiny blood vessels that filter the blood of urea, where if the vessels feeding the kidneys becomes narrowed even, the pressure inside them become higher. Yani if the vessels that feed the kidney itself becomes narrowed with the plaques, so this is going to decrease the amount of blood reaching the kidneys, where the blood is coming with a high pressure to the kidneys, and this will force the protein out through the walls of the capillaries. This is the effect of hypertension on the kidneys. But what about the brain? We know that the brain has very delicate capillaries, and if there is high blood pressure, these capillaries might burst, leading to brain bleeding. But what about the eyes? The mostly affected طبعا is the retinal blood vessels, or the blood vessels that are found in the retina, and this might lead طبعا to blindness. Because if there is atherosclerosis or there is hypertension, طبعا هيعمل atherosclerosis in the tiny blood vessels that supply the retina, that they become blocked. So the retina will not receive enough oxygen and nutrition. It will be starved, of course, and this will lead to blindness because the cells of the retina are going to die, of course. But what's the other effect of atherosclerosis on the heart? Now here, the most common heart diseases that happen because of this atherosclerosis are two conditions. One of them is called angina, and the other one is called myocardial infarction. So what's this and what's that? Let me begin by angina. Actually, it's called angina pectoris. But your books, they always write angina only, so we are following the books, of course. Here, the plaques, they build up slowly in the coronary arteries. So what are the coronary arteries? These are the arteries that supply the cardiac muscle with blood. طبعا supplying the cardiac muscle with oxygen and nutrition. Why بقى? Because the cardiac muscle is a muscle, or it is a part of the body, so it has to respire in order to produce energy to allow the heart to work. The cardiac muscle needs oxygen and it needs nutrition for its respiration. If the coronary arteries are narrowed because of formation of plaque in these arteries, so of course the cardiac muscle will receive less oxygen and less nutrition. The first symptom, let me remind you of this word. Symptoms means what the patient feels. The first symptoms that are noticed by the patient is during exercise. طب why بقى? Because during muscular exercise, the muscles, they need more blood. So, of course, because they need more oxygen and more nutrition in order to produce more energy, the story of more I told you about when you were in OL. During muscular exercise, the muscles, they need more energy. That's why they need more blood to get more oxygen and more nutrition. Of course, here, the heart has to be working harder. Heart rate has to be faster. The amount of blood pumped by the heart has to be more. Because the heart is starving for oxygen and nutrition, it means that the heart will not be able to work harder. This means that the patient is going to feel something wrong with the heart, or طبعا this is appears in the form of a kind of pain called the gripping pain. The first symptoms that are felt by the patients are during muscular exercise, because when the heart is trying to work harder, so of course this will allow the symptoms to appear. Also, because the narrowed coronary arteries, they cannot supply enough oxygen and enough nutrition, this means that, طبعا أنا هنا هتكلم على الأكسجين بس, this means that the cardiac muscle will respire anaerobically. Okay, the cardiac muscle, when it respires anaerobically, it leads to, or it is felt by the heart in the form of the gripping pain. It is a kind of pain that is specific for angina, gripping pain, as if somebody's squeezing the heart. This gripping pain is felt in the chest, it is felt in the left arm, it is felt in the lower jaw. Yes, 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 of course, it is felt in all these parts of the body. And now the patient feels breathless. It's not only the pain, no, the other symptom is breathlessness. As if this patient is starving for oxygen, is trying to get oxygen by any means. طبعا, if such a patient feels these kinds of symptoms, they have to stop exercising immediately. When they stop exercising, so all the symptoms, they are going to subside if the exercise stopped. Now, how can this condition be treated, or treatment of angina? Now, there are two forms of angina. If angina is mild, or a mild form, so وعلى فكرة, most of the anginal attacks, they are mild, يعني usually, and this can be helped by, in order to overcome this, this can be helped by mild exercising. There is no need for hard exercises. طب, like what, for example? Like, for example, walking. يعني even walking half an hour 3 times a week, this can do. Mild exercise, if this patient is overweight, they have to lose weight. And of course, if this patient is a smoker, then stop smoking. Sorry. But what if the طبعا I'd like to say something. طبعا this is not the only treatment. يعني we have to give the patient drugs in order to widen the coronary arteries. The widening of the drugs. Give me a scientific expression for this. Ahmed, I didn't ask you. Give me a scientific expression for widening of arteries. Yes, we have taken this before. But let me help you. Vaso. La, constriction means narrowing. The opposite بقى, yes, thank you, Kenzie. Vasodilation. And these drugs are called vasodilators. Vasodilator drugs. Of course, these drugs will dilate the coronary arteries in order to supply more oxygen to the cardiac muscle. Now, what if the condition is hard بقى, or if we have severe angina? Now here, طبعا severe angina, it means that the condition is becoming worse, or the blockage is continuing in the coronary arteries. So طبعا they use other drugs in order to dilate the blood, the coronary arteries. يبقى vasodilators again. And they have to take drugs to reduce the heart rate, because we do not want the heart to work even with the normal heart rate اللي هو كان بقى 70 beats per minute on average يعني. بس طبعا drugs may not be effective يعني, they have to refer to surgery. وعلى فكرة there is a kind, it's not a surgery يعني, it's putting or inserting something called a stent. It's not يعني a kind of surgery قوي, لكن there is طبعا هنا الستنت دي بتخلي, I'm going to show you the stent بس later on. الستنت دي عبارة عن a tool or a piece of metal that is inserted inside the artery. يعني if this is the blocked artery مثلا, they put the stent like this, something that looks like a coil like this, in order, أنا ما بعرفش أرسمها أبدا by the way. I have a picture, لكن I can show it to you after I finish. فالstent is going to be inserted in order to keep the vessel open. And of course, there is another surgery which is called the bypass surgery. But what is this bypass surgery? Let me show you this picture. Just a second. Aye. Now, if you looked, of course, this is the heart. This part of this is the coronary artery, and this is another one, okay? Of course, this is healthy. There is no blockage. لكن هنا, this is a diseased artery, في atherosclerosis, for example. If you can see that the coronary artery is a branch of the aorta. This is the aorta. Here is the aortic arch, and it's a branch. As soon as the aorta leaves the heart, so it gives a branch to the coronary artery, which is a branch that supplies the cardiac muscle. By the way, never say supply the heart. Supplies the cardiac muscle. Heart includes بقى vessels, muscle, and so on. I'd like to be more accurate when you answer such questions. supplies the cardiac muscle. So if there is a blockage here, for example, let me color this in black. All this part is blocked. It means that no blood is going to pass. So all this area is going to be damaged, of course. They take a part of the vein ودايما بياخدوا from a vein in the leg. يعني if I have here a leg, please don't laugh at my drawing. If this is the thigh, this is the back of the knee, this is the calf. طلع عنده عاهة لازم أعدلها دي. اضحكي اوكي انا اطول رجله شويه برضه مفيش فايده. طب خلاص بقى never mind. This is the heel, this is the foot. We have here a vein that is moving all through the leg. They take this vein, they extract it by the way by a surgery كده بيفتح من حته وبيعمل حاجه زي الهوك كده ويروح ساحب الفين ده كله على بره يبتدي يطلعه بقى. ف they take a part of this vein and they make something like grafting. أو they add a part يعني بيجي يروح مركب الفين look here في الأورتا with the other end to the part that is healthy اللي ما فيهاش البلوكج. يعني the blockage is here or the narrowing, but they put the vein attached to the aorta and attached to this healthy vessels. So blood, of course, is going to pass from the aorta to here inside in order to supply these areas. It means that the part that was damaged or was about to be damaged is going to revitalize again or to gain oxygen and nutrition. It's going to work properly. This kind is called the bypass surgery because we are bypassing the damage. We are crossing over the damage, something like a bridge that we can cross, or the blood can cross in. Right. This is for angina. What about the other type of, just a second, what is this? No. What about the other type of damage, our heart diseases? We have, as I told you, angina, and I mentioned another type of disease called the myocardial infarction. Here بقى the coronary artery is completely blocked. يعني ما بيبقاش طبعا all of it or one of the branches of the coronary artery is completely blocked. فبلاقي ان part of the cardiac muscle is permanently damaged. يعني هنا بيبقى فيه complete blockage of the coronary artery أو branch of it يعني blockage that will lead to permanent damage of the cardiac muscle beyond the block, of course. Here طبعا ال complete blockage is due to formation of الأول الplaque and then followed by clot, and the plaque والclot are going to build up في ال coronary branch, and branches بتبقى narrow, so they are going to be completely blocked. طبعا here the wall of the artery is affected by the plaque. It is hardened, فيها atherosclerosis, and is liable to be damaged أو ممكن يحصل في ال wall of the artery يحصل فيه cracks. فهنا بلاقي إن ال platelets they come in contact with the damaged surface of the plaque and starts the clotting cascade. الplaque may break open. ده لو حصل يعني even في any other artery بلاقي ان البليك يعني if I have here any artery وهنا حصل clot فممكن الاقي ان part of the clot is going to break or to split in order to be carried by the blood to reach the coronary artery to block it. وeven ممكن يحصل البلوكج ده because of atherosclerosis of the branch of the coronary artery. Now, when the clot is stuck in the coronary artery بقول عليه على طول this condition is called coronary thrombosis. Because I told you that we can call it a thrombus. The condition is called thrombosis if this thrombus is caught in the branch of the coronary artery and block it. This is called coronary thrombosis. And this, of course, can block the artery, بتخلي الكاردياك muscle بقى beyond the blockage, تعمل starving to oxygen and nutrients, where this is going to lead to the heart attack. Heart attack is the general term that we use for myocardial infarction. طيب هنا بقى الsymptoms. What are the symptoms? The symptoms here, they are similar to those of angina, but they are much more severe. والpain هنا بقى it happens at any time. يعني في الangina the pain happened following or during exercise. لا هنا pain can happen at any time. يعني طبعا if this patient is exercising the pain can be triggered يعني بس المشكلة هنا إن it can last for several hours even after the exercise stopped. يعني في الangina I just said that pain it subsides by stopping the exercise. لا هنا لا pain can be triggered by the exercise and it lasts for several hours even after stopping the exercise, and of course it can happen at any time, even at rest. Right. When such thing happens, طبعا death. Death might occur, by the way, rapidly without even previous symptoms. يعني ممكن somebody مثلا is feeling tired for several days and then they die. Where sometimes this pain is mistaken for indigestion or misdiagnosed, because we know that this is the diaphragm. Just above the diaphragm we have the heart, where just below the diaphragm there is the stomach. Okay, sometimes the pain may be mistaken for indigestion. يعني if the doctor is wise enough and is following this patient or knowing the history of this patient, they will never diagnose it as indigestion. Of course, they are going to put the first probability something wrong with the heart. This pain is something wrong with the heart, definitely. Right. How can we treat this? Of course, this is considered an emergency case, of course. So we have to do something until the ambulance comes, for example, or this patient is hospitalized or whatever. We have to do something. So this patient has to receive 2 full strength aspirin tablets. Why بقى? Because aspirin is an anticoagulant factor, contains an anticoagulant factors, or it helps the dissolving of the clot or preventing more formation of the clot. I'm going to stop our class here, but before I end the class, I'm going to show you the stent because I promised you. Just a second بقى. I'll get it. يا رب الاقيها اهي الحمد لله. Look at this. This is a plaque. This is called the balloon catheter. It's a kind of something like a very, very delicate tube, very narrow, and it carries, or at its end, there is a balloon. So they put this balloon catheter through مثلا an artery in the arm, in the leg, whatever, and they follow it يعني by a very small incision or a very small cut in the skin, and they insert this balloon catheter to pass through the artery, and they follow it by something like an X-raying from outside. And they follow it until it reaches the part of the plaque. So this balloon is inflated. Look here. It is inflated. So look at the plaque. Instead of being thick, so it became very, very thin because this balloon, when it is inflated, it pushes the plaque to the sides or to the wall of the artery, and then this balloon is deflated and withdrawn. Look at the lumen of the artery here. It was very narrow. Look here, it became wider again, or the blood flow is restored once more. Of course, this plaque is going to build up again or return back. So they have to put this stent. This is the stent. And it's made of stainless steel or some kind of refined plastic. But of course, this stent has to be removed and re-put again after 6 months. I promised you to show you this, and I'm going to end my session now. Thank you all for listening. Thank you, and see you, inshallah, next session. Take care. I'm going to ask you some questions about this at the beginning of next session. Yes, yes, the oral quiz, yes. Okay, thank you all for listening, and see you in good health next time. Bye-bye.